everybody. I am Nina Bosky, and welcome to Mental Health Mondays. It is such a fun intro for me to introduce my next guest. He and I go back to the Stream TV days, right? .TV, at the pioneering stage of digital TV. And Jeff and I both had shows. He had a show a lot longer than I did. His name is Jeff Schubert. Thank you so much for joining us today on Mental Health Mondays.
Thanks so much for having me, Nina. I'm so glad you're doing something like this. Right now is a great time to be having any informative source podcast show that helps people, cope and deal with mental health on a day-to-day basis, given the times we're in.
Well, you and I come from the entertainment industry. And so one of the reasons why I want to do these is that we're taking the life of Marilyn Monroe, all of her life, and, talking about it in a dramatic podcast. But one of the big issues that we want to do, and it was one of our missions, is to shed light on mental health and addiction and the correlation between the two. And interesting enough, you come from entertainment, I come from entertainment, but now you're in the mental health profession. So tell us a little bit about what you're doing and how you help people.
Sure. I've kind of always been in it. My undergraduate degree is in psychology, and I came out to California to pursue entertainment. But for me, helping people was always just as great a passion as entertainment. And I wanted to do that while I'm pursuing it. So currently, for the last 6 years now, I've been working at Hillview Mental Health Center. In their inpatient psychiatric facility for dual diagnosed mentally ill adults. That's a fancy way of saying that most of our clients have a substance abuse addiction issue, as well as a mental health diagnosis in the range of like a schizophrenia, paranoid schizophrenia, schizoaffective, bipolar, major depression, PTSD, and so forth. So we get our clients mostly from the hospital. They're coming off of a 5150 hold. It can be voluntary or involuntary.
And for people that don't know what a 5150 is, I do, but
Sure.
Can you explain what that is?
Sure. So in order to be held on a 5150, you have to be a threat to take your own life or a threat to take someone else's life. So when I say voluntarily, a patient or a person, we call them clients at Hillview, we don't call them patients, can show up at the hospital and talk about suicidal feelings they're having, or they can call and say they've swallowed some pills and whatever. And an involuntary would be someone calling about a person who is a potential threat to themselves, or oftentimes a lot of our clients, they'll be, drugged out on the street and they'll be running in traffic naked or something observable that they're viewed as gravely disabled and a threat to themselves or someone else.
Jeff, I think this is an important topic, and specifically what you do, because in Marilyn Behind the Icon, the first episode is called Please Let Me Out. And she was actually, if you were to look at it, very similar to a 5150 in the sense that her doctor said, no, you've got to go. The unfortunate thing, she didn't really realize what she was getting herself into. And back in 1960, 61, it was much more antiquated than it is today. I mean, she was put in a straitjacket. I mean, there was some, not having any of her belongings. Can you take away maybe some of the fear of what that would represent for a modern day facility such as yours?
Sure. And I think in the 80s, it was President Reagan who kind of took down the long-term psychiatric mental health institutions that we think of when we see, some of the movies or some of what actually happened, right, to Marilyn. Today, it's our facility is voluntary. They will not get released from the hospital until the hospital assesses that they are no longer that threat to themselves or someone else. But they want to kind of step down. They don't want to go right from the 5150 hold, maybe, back to maybe being homeless. A lot of our clients are homeless, or back to a bad sober living, or back to a bad board and care. They need some additional psychiatric stabilization. So they'll come to a place or a facility like mine, and they will get further stabilized on their medications. They'll have one-on-one substance abuse treatment. They'll have one-on-one therapy. They'll have clinical groups. We will help link them to services. If they don't have benefits that they're qualified for, we'll assist them in applying. We'll get their medical care taken care of, so that when they do return to the community, and they'll stay with us anywhere from 30 to 60 days. Sometimes it can be longer if it's medically necessary. They can leave at any time. I always tell them, if you're thinking about leaving before we think it's right, you can tell us and talk to us. We're not going to tackle you. If at the end of the conversation you ultimately want to leave, you can go, but just, give us a chance to talk to you and kind of figure out what your plan is.
Yeah,
Sorry.
so let me ask you something about this, because it's a complicated issue. There's a lot of moving parts, right? And there's this thing where somebody goes away for, let's say, 30 to 60 days, and still the challenge is when they go back into the outside world with all the triggers, with all the stressors, how do they keep from falling down again and going boom and having it be a 6-7 time to whether it's your facility or some type of rehab facility? What do you say to that?
That is an excellent question. And unfortunately, there is a high recurrence rate of being rehospitalized and kind of going kind of round and round. My facility is not technically, there are a lot of facilities similar to ours that are 30-day max facilities, right?
Mhm.
Our facility has carved out an exception with Department of Mental Health. So we do keep clients longer to try to do our best to avoid that. One of the questions I ask our clients from the hospital when I interview them, and I'm the primary interviewer for our facility, is, are you currently linked to any outpatient mental health program? And
Mhm.
a good portion of them are not. So when they leave with us, one of the last things we do is make sure they're linked to an outpatient mental health program so they can keep up with taking their meds, they can keep up with having case management services, they can keep up with being linked to low-income therapies or whatever it is they need to give them that better chance of succeeding.
Another thing that I want to chat with you about as it relates to this in your specific, industry and Marilyn is the challenge that she had with all these medications, right? Her doctors, several months before she died, prescribed to her 900 pills. 700 of them were sleeping pills. Okay. So what do you say to that and the over medication that's happening, not only, then, but now today, specifically, we're in epidemic portions, right? People are just popping pills like they're candy.
Sure, I can speak to both sides of that. First and foremost, if this wasn't a clean podcast, I would let out some four-letter words over 900 pills, right? Because it sounds
Yeah.
ridiculous. And I
Yeah.
want to be clear, I'm not a doctor, but I'm comfortable when I say that the medical director of my program, if anyone ever came in with even a fraction of that, when someone comes in over medicated, he'll say, this is ridiculous. He'll see what the discharge paperwork, what the history is. And his philosophy is maximum benefit with least amount of medications. And med stabilization is a big part of our program. We want to see what's working. If it's working and the doctor can lower the dose, he will very frequently do that. And then if the client's symptoms remain the same, he'll go lower. He just wants to give the clients the minimum amount of medications so that they stop hearing voices, or so that their depression uplifts enough so that they can engage in therapy and learning the coping skills, because it's never just medication, right? It's medication in combination with. So yeah, the philosophy of our mental health facility is not to over medicate. But having said that, there is a clear difference in our clients when they're taking the right meds and not taking the street drugs, and they're doing the therapy and they're doing the right things. You do see that there is benefit to it. And while I don't think, whether we're talking about my clients or anyone who might be listening to this, medication shouldn't be the first thing you rush into, but it is something to consider depending on your level of depression and anxiety.
Well, and I'm a firm believer in looking at the whole person, right? And I've got my own thoughts about how we're supplying medication relatively easily to people without really looking at their brains and stuff as well. So you and I could go on a whole other interview on that subject alone. But one of the things that I think is really important is 700 of those were sleeping pills. And the combination of those drugs were Nembutal and chloral hydrate, which were given at the same time. And the chloral hydrate is Michael Jackson, highly, highly, intoxicating drug, and really should only be given in medical supervision. But she had these in her house. and they played kind of Russian roulette with her pills. If they saw that she was taking too many, the doctor would actually put them in his pocket at times. I mean, it was, very, very antiquated. So I want to put some of the blame on the fact that it was 1962 and,
Right.
people smoking and drinking and doing all this stuff that today, in today's standards, would totally not be appropriate. And these two doctors would probably go to jail. But even so, they had to have known the dangerous qualities of combining those two drugs, right, Jeff?
Yes. Yeah, you would think that it would be irresponsible for them not to. And
Yeah,
often,
and exactly, and so when you think about that, and then what was happening is the drugs that they were giving her were barbiturates, so they were heavy barbiturates, and they contradicted each other, and did not she had a very challenging time with her sleep. So the day that she died, she didn't have anything to eat. She hadn't slept the night before, and she was chronically on these pills longer than this. But we know for the last 90 days, she had those pills having access to those. And so what we think now is that she might have had what they call a mixed episode, and where she had the kind of the mania and the depressive and the bipolar part of her kind of happening at the same time. People, I think, have challenges as they relate to suicide. And some people think, oh, if I write a note, then it's suicide. If I don't, it's not. What are your feelings around this? And what are some of the standards today of how they look at when somebody commits suicide?
well, first of all, with suicide, and a lot of people, myself included, have shared messages on social media and so forth that if you're feeling suicidal, of course, call hotline, seek out support, help, right away. And that's very true. But as you and I both agree that there's too much of a stigma on mental health, right? The time to get help is long before that. What I mean is if you were feeling fluish for a few days, you wouldn't wait until it developed into pneumonia, hopefully, until you got help. Long before you're feeling suicidal, which I would call, let's say, stage 4 of depression, right? That's potentially the deadly you don't recover from stage, right? That's super dangerous. You wanna get help much faster than that. In my clinical groups that I lead, I'll talk about on a scale of 1 to 10, with 10 being highest. If you're suicidal at levels 7, 8, or 9, then by 4, 5, and 6, you should be reaching out.
Yeah.
Don't wait till 7, 8, or 9. Don't wait till
I,
you're on the roof.
I love that analogy, because that is so true. How many of us wait and wait and wait, and then something happens to a loved one and we go, oh my gosh, I didn't know. And yet they were giving you signs, or somebody says I'm suicidal all the time.
Right.
And then what happens is you start to cry wolf, and you don't believe them. And then it's that time that they go for it, that they are literally, they pass. And then the person that didn't believe them actually has a lot of guilty feelings, I would say, as well. So what do you say to somebody that is right now maybe having either suicidal thoughts or is depressed? Because sometimes you don't even know what you're feeling. What do you say to that?
Well, now is a very overwhelming time, right? Not only under normal times are we fighting to improve our lives, maintain our jobs, our relationships. Now they're under greater stress, and things seem to be, happening out of nowhere. So what I say is the fundamentals of mental health don't change just because we're in crisis. If anything, it becomes more important to do things like focus on what you can control versus what you can't control, right? If you're going to focus on what you can control, that's going to kickstart your anxiety. It's going to kickstart your depression. It can trigger post-traumatic stress, which on some level, I mean, I love our veterans. I think on some level, all of us suffer a little bit of PTSD from something. Whenever you
Yes.
react in the present moment based on something that happened to you in the past, to me, that's a little bit form of PTSD, right?
Yeah. Yeah. That's a very good point, Jeff.
So focus on what you can control versus what you can't. Time management, right? Create a schedule for yourself. It sucks that most of us are in a type of quarantine situation, but now is the time to take that online free writing class to write that book about your life that you've been thinking about doing, or that screenplay that you've had in your head. So many things that you don't have time to do, you do have time to do now with the internet. I think I wrote it down. I think it's called openculture.com. They have over 1,500 free classes
Oh, wow.
that you can take online from various universities and so forth. Study healthy eating. I've been a big proponent of a healthy lifestyle, not only for cancer prevention, heart disease, diabetes, but if preventing those things isn't enough, it will help your immune system, and take away some of those things that make you more likely to be a victim of COVID, right? So study
Yeah.
healthy eating. If you're feeling, do think, change, change the thought pattern. Get up, go for a walk, get some exercise, but don't allow yourself to sink and stew in a depressive episode, if you will. You have to do something to change the neurons in your brain.
Yeah, and what do you say though? Because this is a real challenge, because I have dealt with people who have either bipolar and or borderline personality, and those two particularly are more challenging because they're highly, highly creative, very intelligent people for the most part. And they've suppressed their minds in order to kind of calm down that mind in not a healthy form. Like you said, go for a walk, eat right, what you put into your body, etc. And so they stop taking their medication. They stop, doing the things that they know is really good for them. So what do you say to that? Because we got to get people making sure that they're getting, one, the right diagnosis, right? Not just popping
Sure.
pills because a
Sure.
doctor tells them to.
Right.
And then two, how can they, how can we get them to stay on their path? That's the key, right?
Well, yeah, and that's a big challenge in mental health is when medications are working, you feel like you don't need them anymore, right? I got
Yes,
this. It's like
exactly.
I got this is a phrase often heard by people where I work, from clients who come back to us a second and third time, right?
Yeah.
They discharge against medical advice. They get off their meds. They think they got it. They do well for maybe a month or two, whatever, and then they come back. They're like, man, I did not have it. So unfortunately, I mean, psychology, even psychiatry, they're fields that, relatively speaking, are still in their infancy. We don't have all the answers. If we did, we'd know it. Unfortunately, clients have to hit their own, bottom to come back and realize that they still need the help. And that in the case of a bipolar individual, he or she, may need to be on some kind of medication the rest of their life. And it's a decision they have to come to on their own. Hopefully, it's not what do I say to the bipolar person listening. It's what do I say to the loved ones of the bipolar person listening.
Oh, don't get me started on this one, because that is so true on so many levels, because we're only as healthy as the people who are around us, right? And so if I'm around enablers and I'm a family member or a friend, and I'm inadvertently, I don't want to feel bad myself, so I'm not going to take a stand, that becomes a real challenge, because who's more in terms of the healthy habits, right? It affects the whole family unit. And I think it's so important. What do you say right now?
This last quick thought is yes, because oftentimes the family and the loved ones could play into the stigma of mental health, the stigma of being on medication, and make it harder for the person to accept the help.
Yeah, and also they are, sometimes they don't want to have to deal with it. I've had situations where family members are actually, well, they're doing it at home, so at least I know where they are, right?
Right.
And so, the whole family gets in a dysfunction, which is a real challenge. And I also think, in terms of Marilyn, some of the people around her were just not, oh, that's just Marilyn being Marilyn. And I think we get into these chronic depressive states, or, somebody might have mental health issues, and we start to think that, oh, that's just, they'll snap out of it. And it's a hard one, because when do you take it, seriously, and when do you don't? And I liked what you said about don't wait until it's a crisis. If you're starting to feel depressed, we're in COVID right now. We're in civil unrest. We're in an election year. Things are coming and going. And I remember talking about this with another mental health interview. We talked about, it affects our careers, our finances, our health, our social, our families, our children. So we're really having to adjust and adapt in this COVID environment. What's happening in terms of the field of mental health, where you are looking at it from a COVID perspective? Are you finding that it's getting worse, or are you finding it relatively the same since COVID hit?
For the population that I deal with, it is close to the same. And the reason I say that is because our clients, when they're in our facility, the only time they can leave is when accompanied by staff. So they're kind of used to a limited form of kind of mental, it's more of a mental health quarantine than a COVID quarantine.
Yeah.
So, but it is affecting them, but their needs and worries are their mental health stability, being drug-free, getting housing, applying for benefits. And to the extent that COVID is slowing that stuff down, it's affecting them.
Yes. Yeah. And I would say that, what I'm hearing is some of the, domestic violence, suicide for the other parts of the population
Yes.
are really challenged, because if I was let's say a high functioning adult that could distract myself by going everywhere, right now I can't. And now I have to deal with my loved ones or deal with myself in a way that I haven't, or I lost my job that I defined myself by, or my children, or I've lost loved ones. It's certainly affecting the statistics. So,
So
yeah,
so I
go
just
ahead.
want to say that's very, very serious. And obviously anyone watching this who might be in a domestic violence type of situation, um, yeah, you got to call and get, legal
And
help.
unfortunately, child abuse, at least a
Yeah,
few months ago when I looked at the stats, were pretty alarming as
yeah.
well. So, I think one of the things that at least we know of Marilyn and the side of her that most people connect with, here we are talking about her 58 years later, right, and why she still affects people the way that she does, is she had a very generous, sweet, vulnerable heart, and she was very sensitive. And the one thing I could say that I would almost bet my life on it, I wouldn't necessarily bet my life, but almost, right, is that, she really would care for the underprivileged. She definitely was a human rights activist and animal activist, and I can't imagine that she wouldn't want people that are getting help in all populations as well. So is there any closing thoughts you would like to bring to the table today around mental health, your organization, or just you would want people to know, Jeff?
Uh, you can't will it to happen, right? It's like I was having a conversation the other day, an athlete, a three-sport star. I'm like, how did you get to do that? Did you think about it? Did you will it, or did you have to practice? Did it take discipline? That applies to mental health too. You have to be diligent about it. I often say the worst time to prepare for an earthquake is in an earthquake. Californians will appreciate that, right?
Yeah.
So we're in that now, unfortunately. But you can budget your time. You could spend less time on social media if it's increasing your anxiety. Make a list of the things that you can control and the things that you can't, and focus on the ones that you can. You can still put together a full day with exercise, with reading, with listening to music, with Zoom conversations with loved ones, so you can still see them if you can't physically be with them. There's a lot of things you can rotate and do during this time if you focus on that and not on the negative. And I
I,
wish you
I
luck.
I hope that, what you're talking for people to actually do and implement in their life, that they will take it seriously to heart. Because if you wait and watch all the media out there and don't take charge of your own mind, right, that mind will just take you away, and it'll take you to places you probably don't want to go. So all the things that you are mentioning today are such great things. Please reach out for help. Get connected, get supported. You got some tools here today. And then how can they reach you if they have maybe a loved one? I know you hit a specific community in regards to your healing profession, but maybe somebody has a loved one that might be homeless or in that challenge time in their life. How can they get a hold of you because you're here in Los Angeles, how can they get a hold of, at the website?
Well, a great resource for everyone. I think 211 is active in every state. And
Yes.
and if you call that and you need access to maybe homeless resources or mental health services in your area. So for example, even my mental health agency only operates within a very narrow territory. And then they're called service areas. Every area within the LA area community has a different service area, and they would be referred to different agencies based on where they were located. 211 could be a great access to help you find services in your area. If you have health insurance, you can call them and find out what maybe virtual groups you might be able to go to, or what online services or therapy you might be eligible for, and so forth.
That'd be great. So 211, Jeff Schubert. Boy, have we come a long way, baby, right?
Yeah,
Nice,
absolutely.
nice to have you here talking about this very important issue. Keep doing what you're doing. We need you out there in the front lines too. And
And
stay
we need
safe,
you.
my friend.
You too. I look forward to more episodes of Marilyn.
All right. Take good care.
You too.